Have you ever thought about how quickly life can change in an instant? One moment you're living your normal day. The next, everything is different. It's a sobering thought, but something that far too many of us, especially as we get a little older, need to be truly aware of. We often hear about stroke, but what many don't realize is that stroke doesn't always hit like a sudden, undeniable thunderbolt. Sometimes, it whispers first. It gives subtle clues, little nudges that, if you know what to look for, can be life-saving warnings. The heartbreaking truth is that countless seniors miss these vital early signals, leading to outcomes that could have been avoided. Imagine losing your ability to speak clearly, or to use your hands to hold your grandchildren, all because a tiny warning sign went unnoticed. It's a painful reality, and it happens more often than you'd think. But it doesn't have to be your story. There's a secret to protecting yourself and your loved ones, and it's simpler than you might imagine. It's all about knowing. In this video, we're going to uncover the 7 crucial, often missed early signs of stroke that seniors absolutely need to know. These aren't just medical terms, they're real-life signals that demand your attention. Knowing them could make all the difference, preserving your independence, your quality of life, and your precious time with family. Make sure you watch this video all the way to the end, because there's something waiting for you that might just surprise you and change the way you think about your health forever. Now, let's dive right into these crucial signs that many people, even doctors sometimes, don't immediately connect with a potential stroke. It's about catching these whispers before they become shouts. The very first sign, and one of the most common, is a sudden weakness or numbness, often on just one side of your body. This isn't just your arm falling asleep because you've been lying on it funny, or a bit of pins and needles after sitting too long. This is different. It's a sudden, unexplained feeling, like one side of your face, or one arm, or one leg, just feels heavy, unresponsive, or numb. Imagine you're holding your morning cup of tea, and suddenly, without warning, your grip on one hand feels a bit off, weaker than the other. Or you're trying to button your shirt, and the fingers on one hand just aren't cooperating like they normally do. Perhaps you try to walk, and one leg feels like it's dragging slightly, or your foot feels strangely heavy. It might even be a subtle droop in one side of your face when you try to smile or speak. Many people try to brush this off, thinking, "Oh, I must have slept funny," or "It's just my arthritis acting up." But if it's sudden and affects just one side, even if it comes and goes, it's a serious red flag. Don't wait to see if it gets better. This sudden, one-sided weakness or numbness means it's time to call for emergency help immediately. Moving on to our second vital sign. And this one can be particularly frightening because it affects how we communicate and understand the world around us. It's a sudden confusion, or trouble speaking or understanding speech. This isn't just forgetting where you put your keys. This is a profound, abrupt change. Someone having a stroke might suddenly start slurring their words, sounding like they've had a few too many drinks, even if they haven't touched a drop. They might struggle to find the right words, substituting them with strange sounds or completely unrelated words. Or they might be utterly unable to speak at all. Imagine trying to explain something simple, like what you want for dinner, and the words just won't form properly. Or what comes out makes no sense. Equally important, they might suddenly have trouble understanding what you're saying to them. You might ask a simple question, and they look at you blankly, as if you're speaking a foreign language. They might seem confused or disoriented out of the blue. Their mind might seem foggy, but not just sleepy or tired. More like their brain is literally struggling to process information. This isn't something to explain away as just an off day or senior moments. If you notice this sudden change in someone's speech or understanding, or if you experience it yourself, it's an emergency. Every second counts, and getting immediate medical attention is absolutely critical. And that brings us to our third early warning sign, which can also be quite subtle and easily dismissed. But it's incredibly important sudden trouble seeing in one or both eyes. Now, this isn't just needing new glasses or your vision blurring gradually throughout the day. This is a sudden, often dramatic, change in your eyesight. You might experience sudden blurred vision in one eye, or even both eyes. That comes on without explanation. It could be double vision, where everything looks like it has a ghostly duplicate, or, even more alarming, a sudden loss of vision in part of your visual field, or even complete loss of vision in one eye, almost like a curtain coming down. Imagine you're reading your favorite book, and suddenly, a whole line of text disappears, or half a page seems to vanish. Or you look at your television, and one side of the screen just isn't there anymore. Some people describe it as if they're looking through dirty glass or a fog, but it happens abruptly. It's easy to think, oh, my eyes are just tired, or I must have rubbed something into them. But if this visual disturbance is sudden, unexplained, and affects one or both eyes, don't hesitate. Your vision is precious, and this sudden change can be a clear signal that something serious is happening inside your brain. Don't take a wait-and-see approach with any of these first three signs. Time truly is brain. The faster medical professionals can act, the more brain function can be saved, potentially preventing long-term disability. As we continue our vital discussion, let's turn our attention to the fourth early sign of stroke, which often gets mistaken for just feeling a bit unsteady or having an off day. This is sudden trouble walking, unexplained dizziness, or a sudden loss of balance and coordination. We all might feel a little wobbly sometimes, perhaps after standing up too quickly, or if our blood sugar is a bit low. But this is different. This is a sudden, profound inability to walk straight, or a feeling of spinning or unsteadiness that comes on abruptly and doesn't go away. You might find yourself suddenly stumbling for no reason, or feeling like you're going to fall, even when you're just standing still. Your balance might suddenly feel completely off, like the ground is shifting beneath you. You might try to walk a straight line and find yourself veering dramatically to one side. Or you might find your limbs aren't coordinating properly, making simple movements feel clumsy and difficult. Imagine you're just walking across your kitchen, and suddenly you feel incredibly dizzy. Not just a lightheadedness, but a dizzy spell that makes the whole room spin. And you find yourself struggling to stay upright, or perhaps you reach for something, and your hand completely misses. Or you drop things unexpectedly because your coordination has gone awry. If you or someone you know experiences this sudden and severe loss of balance or coordination, especially if it's accompanied by any of the other signs we've discussed, it's a serious warning. It's not just a sign of aging or being tired. It can indicate that blood flow to the balance centers of your brain is being interrupted. This is not the time to walk it off or wait for it to pass. It requires immediate attention. Now that we've discussed trouble with walking and balance, let's talk about a symptom that can be incredibly alarming and demands immediate attention: the fifth sign. A sudden, severe headache with no known cause. This isn't your typical tension headache or a migraine you've had before. This is often described as the worst headache of your life, coming on abruptly, like a thunderclap. It hits you instantly, reaching its peak intensity within seconds or a minute. And it's unlike any pain you've ever experienced. It might be accompanied by a stiff neck, changes in vision, or even feeling unwell or losing consciousness. Imagine you're simply relaxing, and out of nowhere, an excruciating, blinding pain explodes in your head. A pain so severe it makes you gasp or cry out. It doesn't slowly build. It's just there, at full force, immediately. Many people unfortunately dismiss severe headaches, thinking they're just stressed or dehydrated. But if a headache hits you with this kind of sudden, unprecedented intensity, especially if you've never had headaches like it before, it can be a critical sign of bleeding in the brain or a stroke. This is absolutely not a symptom to ignore, or to just take a pain reliever for. If you or someone you're with experiences a headache like this, It's a clear signal to call emergency services without delay. Your brain is giving you a powerful, unmistakable warning. Next, we'll dive into a sixth sign that's often quite visible, but sometimes people don't immediately recognize its significance: sudden drooping of one side of the face, or facial asymmetry. This is one of the classic signs often highlighted in public awareness campaigns like FAST, F for face drooping. It means that when you try to smile, or just in your natural relaxed state, one side of your face might look different from the other. One corner of your mouth might sag, or your eye might not close completely on one side, or your cheek might look flat. Someone might try to smile, and only half of their mouth moves upwards, creating a lopsided, uneven smile. You might notice it when looking in a mirror, or a loved one might notice it in you. It can be subtle at first, maybe just a slight asymmetry, or it can be very pronounced. Imagine you're chatting with a friend, and suddenly you notice that their smile seems off, or one of their eyelids looks a little droopy, or perhaps you try to whistle, and air leaks out of one side of your mouth. This isn't just a nervous twitch or a fleeting expression. This is a persistent, sudden change. If you suspect this, ask the person to smile widely, or to show their teeth. If one side of their face doesn't move as well as the other, or if it sags, that's a very strong indicator of a potential stroke. Don't be shy about pointing it out or asking them to check. This visual cue is a direct sign that brain signals controlling facial muscles have been interrupted. It's another emergency signal. Finally, we come to our seventh early sign, one that can be particularly distressing and often goes overlooked or is attributed to other, less serious causes: sudden difficulty swallowing, or excessive drooling. This isn't just a bit of food going down the wrong pipe, or a momentary cough after taking a drink. This is a sudden, persistent problem where swallowing becomes genuinely difficult, painful, or even impossible. You might find yourself choking on your own saliva, or on food and drink, even soft textures. There might be a noticeable increase in drooling because you're no longer able to swallow effectively. Imagine you're having a meal, and suddenly, you can't seem to get the food down. No matter how hard you try, it feels like it's stuck. Or you start coughing violently with every sip of water. This is incredibly dangerous because it puts you at risk of choking or aspirating food or liquid into your lungs, which can lead to serious infections like pneumonia. If you notice a sudden, unexplained difficulty in swallowing, or if someone around you suddenly starts drooling excessively or coughing when they try to swallow, do not dismiss it. This symptom can indicate damage to the parts of the brain that control the complex act of swallowing. Like all the other signs we've discussed, this is a profound and urgent signal from your body that something is critically wrong. These 7 signs, while varied, all share one crucial characteristic: they are sudden. They don't gradually appear over hours or days. They happen abruptly. Recognizing this sudden onset is key. So, we've walked through the 7 critical early signs of stroke that far too many people miss: that sudden, unexplained weakness or numbness on one side of your body, the alarming trouble with speaking or understanding speech, the unsettling, abrupt changes in your vision, the sudden loss of balance or coordination that leaves you feeling unsteady. That severe, sudden thunderclap headache unlike any you've ever experienced. The noticeable, sudden drooping of one side of your face, and the distressing, sudden difficulty swallowing or excessive drooling. Remember, the common thread linking all of these is their sudden onset. They appear without warning, out of the blue. If you or someone you're with experiences any of these signs, even if they seem to come and go, even if they're subtle, please, do not hesitate for a second. The most important, life-saving action you can take is to immediately call for emergency medical help. In the UK, that's 999. In North America, it's 911. In other English-speaking countries, know your emergency number. Time is truly precious when it comes to stroke. Every minute that passes without treatment means more brain cells can be lost. And that loss can be irreversible. Getting to a hospital quickly means you or your loved one can receive treatments that can stop the stroke in its tracks, minimizing damage and improving the chances of a full recovery. Don't worry about being wrong or making a fuss. It's always better to be safe, and let medical professionals assess the situation. Your health, your future, and your independence are worth every bit of that immediate action. Now, for that surprise I promised you at the very beginning. While this video has focused on your knowledge and your health, the biggest surprise might just be this. Your awareness isn't just for you. It's for everyone around you. You see, very often, the person experiencing a stroke might not be aware of what's happening. Their confusion, their difficulty speaking, or their altered vision might prevent them from recognizing the danger or calling for help. This is where you come in. By knowing these signs, you become a potential lifesaver for your spouse, your children, your grandchildren, your friends, your neighbors, or even a stranger you encounter. Imagine being at a social gathering, and you notice a friend's smile looks a little off, or they suddenly start slurring their words. Your quick recognition of these signs could literally be the difference between a minor incident and a devastating, life-altering event for them. So the surprise is that this knowledge isn't just a shield for yourself. It's a powerful tool to protect your entire community. Share what you've learned today. Talk about these signs with your loved ones. Educate your family. Encourage them to be vigilant, not just for you, but for each other. This collective awareness is one of the most powerful defenses we have against the devastating impact of stroke. Remember, taking small steps and being informed can make an enormous difference in your health and happiness, and the health and happiness of those you care about. You have the power to protect yourself and others by simply being vigilant and knowing what to look for. You are not alone in this journey, and every piece of knowledge you gain is a step towards a healthier, more secure future. We truly hope this information has been valuable for you. We'd love to hear your thoughts or any experiences you might have had related to recognizing these signs. Please share them in the comments section below. Your stories can help others too. And if you found this video helpful, please give it a big thumbs up. That really helps us reach more people who need this vital information. Also, don't forget to subscribe to our channel and hit that notification bell, so you don't miss out on more helpful content designed to help you live your best, healthiest life. You deserve to live your best life, vibrant and independent. At every age, take care of yourself and each other. Until next time, stay well.